A flu shot is the best protection against the flu, but then what can we do if we come down with the flu? Some suggest taking antivirals, but there is some confusion about just what they do and what they are. Dr. Donald Vinh is an infectious diseases specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Don, what is an antiviral? I mean, is it comparable to an antibiotic for bacterial infections?
Yeah, so an antiviral is a medication designed to fight viruses, much like antibiotics are designed to combat bacteria. But the distinction between the two is critical. They are not interchangeable. Antivirals work by slowing the virus's ability to multiply and spread throughout the body, buying time for the immune system to respond more effectively and regain the upper hand. Antibiotics, by contrast, are aimed squarely at bacteria. They're essential in medicine, but they do not work against viruses such as the flu. So while antivirals and antibiotics share a common goal, which is to fight infections, their targets are fundamentally different, and using the right tool for the right pathogen makes all the difference.
But how effective is an antiviral? I mean, as you say, it can slow it down, but can it actually cure a flu, or will it just lessen our symptoms?
Yeah, so flu antivirals are not a magic cure, but they are an important part of our treatment toolbox. When taken early, flu antivirals can shorten the duration of the flu, reduce the severity of the symptoms, and most importantly, lower the risk of serious complications, especially in people who are more vulnerable. Think of it this way, right? And antivirals are like putting on a parka when the temperature plummets to minus 25. They won't make winter disappear, but they can blunt the cold and help you get through it more safely. For some people, that difference can mean fewer days in bed. For others, it can mean avoiding hospitalization altogether.
And how is an antiviral used, Don? I mean, we hear that it's got to be taken fairly early on. Is that true?
Yeah, so timing matters because flu moves fast. In the first 24 to 48 hours, the virus is replicating at its highest rate. Antivirals work by slowing that process. When treatment begins earlier in the illness, it can blunt the virus as it's trying to gain momentum. That's why treatment is most effective when it's begun near the onset of symptoms. After that window, antivirals may still benefit certain high-risk or hospitalized patients, but the clinical impact really is greatest when therapy is initiated earlier.
So what other illnesses can antivirals be used for other than the flu? I mean, or should be used for? I mean, things like, I don't know, shingles, measles?
Yeah, so antivirals are used for different viral infections, but they are highly specific. Each one is designed for a particular virus. So for shingles, we have well-established antivirals that, when started early, they can shorten the duration of the rash, reduce the pain of shingles, but they also lower the risk of this long-term nerve complication called post-herpetic neuralgia. But once again, timing matters. On the other hand, measles is different. It's a virus, but there is no antiviral drug available to treat measles. Care in that case is really largely supportive, which is why prevention through vaccination is so important. So the key takeaway in all this, Mitsumi, is there is no single antiviral panacea, but there is antiviral precision. Each medication is carefully designed to the biology of a specific virus, and it's that precision that makes these treatments effective.
Also, Don, you know, I've heard about people testing positive for the flu. Does this mean we should be testing for it like we did with COVID?
Yeah, so for many people, during flu season, that means when the influenza virus is the prevalent circulating virus, the diagnosis can be made based on symptoms alone. But testing specifically for flu becomes most useful when the diagnosis is less clear and when the result will affect clinical decisions. So for example, it can help doctors prescribe antivirals early when appropriate. It can help to decide which vulnerable people may need hospitalizations, and can even avoid unnecessary antibiotics because, as I said, antibiotics don't treat viral infections.
And very quickly, Don, because we're almost out of time, antivirals aside, what can we do with the flu if we get it?
Yeah, if you get the flu, the fundamentals still matter. Rest, hydration, staying home to protect others, but importantly, know when to seek help. So if symptoms are severe or worsening, or if you're older, you're pregnant, or living with a chronic health condition, you need to reach out early. That's not overreacting, that's just smart preventive care. But it's important to remember that while flu is common, it's not trivial, and it also reminds us, because it can be dangerous, that prevention through vaccination is key.
Okay, thank you very much for this, Don.
Thank you, Mitsumi.